Hey everyone, welcome to another digital specimen walkthrough. As always, we're going to be using the Cardioscape platform, which is available for free for Mac OS and for Windows at www.learnchd.com. Once again, completely free and available at www.learnchd.com. Remember, Cardioscape is a platform that's a digital cardiac anatomy education platform where we've taken actual heart specimens, 3D scanned them, and then made the models fully available for all of you for your education. So today we're going to go ahead and look at this model made from a specimen with pulmonary atresia and intact ventricular septum. You'll see we've got two different models here, one from the right side of the heart and one from the left side of the heart. We'll go ahead and turn off the left side for now. We'll shut off the labels. And the heart would have sat roughly in the chest like this, with the anterior surface coming out towards the screen, posterior surface going into the screen, head or superior here, legs or inferior down here, left over here, and then right over here. And you'll see that the lungs are still attached to this specimen. We'll start off as we usually do, which is by trying to identify the right atrial appendage, at least externally. And this heart's already opened, but here is what appears to be a triangular, pyramidal, or broad-based appendage consistent with the morphologic right atrial appendage. And when we look inside this heart, we do see some pectinate muscles that spill outside the confines of this appendage consistent with the morphologic right atrium. Now we'll go ahead and zoom into the right atrium here. Here's the oval fossa, and you can see that there is in fact a atrial septal defect here in the oval fossa. So there's an oval fossa atrial septal defect. We also see that the superior caval vein is draining into this right atrium. So here's a superior caval vein draining into the superior aspect of the right atrium, and here is where the superior caval vein enters the right atrium. Then here we find the mouth of the coronary sinus draining into the right atrium. Here is the tendon of Totaro, and the tendon of Totaro and the mouth of the coronary sinus, as well as the right-sided atrioventricular junction, form the triangle of Koch. And so here is the triangle, and at its apex, which would be roughly here, is where we would expect the AV node to be. So we would expect the atrioventricular node in this heart to sit here. Now right off the bat, we can see that the tricuspid valve is pretty hypoplastic, right? And so here is the tricuspid valve. We are now looking down at it. Here's the right atrium, here's the tricuspid valve, and below this is the right ventricle. So a hypoplastic tricuspid valve. Here's its anterior leaflet, here's its septal leaflet, and here's the inferior leaflet here. And it opens up into a pretty hypoplastic right ventricle as well. So here's the right ventricle, and we can see that it is pretty hypoplastic. And so here's a tricuspid valve that's hypoplastic, here's a right ventricle that's hypoplastic, and then when we go and look at the outflow tract here, at the right ventricular outflow tract, it has a blind end to it. So we are dealing with pulmonary atresia, and the ventricular septum is entirely intact. So this is a specimen with pulmonary atresia and intact ventricular septum. That explains why the right ventricle is hypoplastic and why the tricuspid valve is hypoplastic. Remember, clinically, having a small tricuspid valve is usually associated with not being able to perform a biventricular repair. And here's that intact ventricular septum. Now let's go ahead and take a look at the other side of this heart. And I apologize. I don't know why it won't let me. Let's go ahead and get out and get back into this, and hopefully we'll be able to load up the left-sided scan. And there we go. So now here's that same heart. Once again, we have the lungs here. The orientation is a little different. Now anterior is up here, and posterior is here, head or superior is here, inferior legs over here. We see that the free wall of the left ventricle is now kind of being pulled towards the screen. And here's the anterior leaflet of the mitral valve. And we see that the mitral valve has no direct connections to the ventricular septum. This ventricle it opens up into has fine crisscross trabeculations consistent with the morphologic left ventricle. And then here's the aortic valve, and then the ascending aorta. So a normal left side with a normal left ventricle, a normal mitral valve, and a normal aortic valve, which is usually the case in the setting of pulmonary atresia with intact ventricular septum. And once again, from the left, we can also see that the ventricular septum is intact. And then here is the pulmonary outflow tract again. Here's the RV, the pulmonary outflow tract, and then here is the pulmonary trunk. You can see there's no connection, once again, between the right ventricle and the pulmonary trunk. This is where we would have expected the valve to be. And so here's the pulmonary trunk, which seems to be of good size. And then the branch pulmonary arteries here and here, which also both seem to be of good size. So here's the left pulmonary artery, here's the right pulmonary artery, and then here are some of the pulmonary veins coming back to the right atrium, and here is the left atrial appendage. So a heart with pulmonary atresia, an intact ventricular septum with a hypoplastic tricuspid valve, and a hypoplastic bipartite right ventricle.